Am I audible? Is my screen visible? Am I audible? Is my screen visible now? Yeah. So during childhood, a lot of worm infections, okay, not having food properly. In female kids, it's more common than male kids because females, girl children, they are neglected. Usually it is seen in the rural India. In urban India, we see much more gender equality now. But in rural India, still the girl child's food and nutritional needs are overlooked while feeding the as compared to a male child. Okay. So that also leads to anemia. Then in teenage for girls when she attains puberty, when menarche starts, that leads to if it is a heavy blood loss. If a teenage girl is suffering from heavy blood loss during menstruation, she becomes anemic. Okay, again, not having enough food because of the growth spurt. There is a growth spurt period. Immediately within few months, the child will increase in height. Okay, few inches, and also they will put on weight. Their appetite is high, and if the food is not able to satisfy their nutritional needs, it also leads to anemia. Okay. Gender discrimination, again, not just in childhood but also for teenage, in among teenage kids as well, when there is gender discrimination. Nutritional requirements, also educational requirements of girl children is overlooked as compared to boys. Okay? Very common in the backward societies even today. Teenage pregnancies, early marriage, child marriage, okay, these also leads to anemia. Then in adults, dietary deficiency, not having enough awareness of iron-rich food, importance of iron-rich food, tuberculosis, if the adults have any malignant diseases like cancer, okay, if they have undergone any surgery in the intestine, celiac disease, Crohn's disease, if the diet has high amounts of oxalates, phytates, tannins, okay, if you are not washing and soaking your legumes properly, your pulses and legumes, if you're not washing and soaking it properly before cooking it, that also leads to anemia. Okay, because legumes and pulses, they have high amount of oxalates and phytates. So that's why you have to soak them, wash them properly, soak them, throw the soaked away water. Okay, you can use that water that you have used to soak your legumes in agriculture. Okay, or even if you have some kitchen garden, you can use there, but don't use it in cooking. Okay, it has high amounts of phytates and oxalates, so that will interfere with iron absorption. Okay, certain bacteria that overgrows in your intestine, if your probiotics are not well fed enough, okay, you don't have a lot of distinct varieties of probiotics in your intestine, that can also lead to anemia. Any worm infections, which is very rare in adults. Worm infections usually don't take place in adults. It is very rare. Okay, but if it takes place, but if it takes place, that could also lead to anemia. Okay, so that's for adults. During pregnancy, again, during pregnancy, the requirement to maintain pregnancy is quite high. Okay, it's a physiological need that the body undergoes so much of changes. Blood volume in the mother doubles. Okay, the cardiac output, blood volume, it doubles in a mother's body. Okay. So if the nutritional requirement of the mother is not able to keep up, okay, if the nutritional requirement is not able to keep up, that would lead to anemia. And also if she is not taking enough amount of iron tablets, folic acid tablets, okay, so that would also lead to anemia. Any doubts so far? Then again, any complicated pregnancy, if the mothers are having any complicated pregnancy, that can also lead to anemia. Increased parity, parity means the number of time a woman gets pregnant. Okay. So if she has given birth or she had successful deliveries more than 2 and 3 times, okay, she is a mother of more than 3 or 4 children. That we call it increased parity. Okay. Hemodilution means the blood volume is increasing. As I mentioned, blood volume doubles. Just imagine you right now you just have around 2 liters of blood. Okay, you just have 2.5 liters of blood in your body. Okay, but during your pregnancy, if you're a woman and you're pregnant, okay, your blood volume doubles. You will get around 4.5 to 5 liters of blood in your body. Okay, so a dilution is taking place. You had some number of cells, and now immediately a lot of water has come into your blood. Okay, so your blood has become diluted. So you require more iron to overcome the dilution so that the blood becomes more concentrated. You need more blood cells now. That is hemodilution. Okay. Occult blood loss happens when you are losing a lot of blood through your feces. Okay. When you pass your motion, your bowel motion, and through that you're losing a lot of blood. That is occult blood loss. Unknown blood loss, like it could be some wound or some ulcer in your stomach, in your intestine, and through that blood is oozing away. Okay, you're passing that in your feces, in your stools. That is occult blood loss. In old age, again, like your intestine shrinks, your intestinal villi that is supposed to absorb the nutrients, that also shrinks in its size. Okay. So not just iron absorption, any nutrient absorption reduces over the period of time when you get older and older. Okay, so that is one reason. Another, they don't have, senior citizens don't have enough appetite to eat a lot of food. Their appetite is reduced, so they don't eat much. The body will not have anything to absorb much. Okay, lack of awareness. Okay, nobody to take care of their health and nutrition. Growing old, you don't have enough somebody to take care of your health and nutrition. That leads to nutritional deficiencies. Okay, so all the causes, is it clear to all? Causes, is it clear to all? Next, you have the types of anemia, different types of anemia. Hypochromic microcytic anemia. Hypochromic means less color. You can see here the image here. Your blood is not that bright red in color because it does not have enough amount of hemoglobin. So it is not that bright red color. Hemoglobin gives that pigment to your blood. Okay, so lack of hemoglobin means your blood will not have that bright, rich red, maroonish color. Okay, so that is hypochromic, less color, hypochrome. Microcytic. You can see here the image of microcytic as compared to a normal blood cell. Very small, micro, small. Cytic cells, very small cells. Okay. So hypochromic microcytic anemia, first of all, the red blood cells don't have enough good color. And second, they are very small in size. That is hypochromic microcytic anemia. It happens because of not having enough iron in your body. So lack of iron leads to hypochromic microcytic anemia. Then megaloblastic anemia. You can see mega means big. Okay. Blastic means yesterday I have mentioned. What do you mean by blast? When you refer to a cell, what do you mean by blast? Immature cells. Okay. Immature, not well developed. So the size of this is quite big, but they're immature. They can't function as normal red blood cells. Okay, so that you may have enough amount of red blood cells, but they are immature. Majority of them are immature, not well developed. Okay, that is megaloblastic anemia. Again, vitamin B12 deficiency, folic acid deficiency. Okay, your DNA is not being synthesized properly. That could lead to megaloblastic anemia. Then dimorphic anemia. Dimorphic anemia, it's the mix of all this, what we have discussed so far, hypochromic, microcytic, megaloblastic. You will find all these kind of unnatural blood cells in the blood sample because the person is not just iron deficient, but also vitamin B12 deficient. You will see this usually in kids who have malnourishment, okay, malnourished children, severe nutritional deficiency struck individuals like TB patients. Okay. Because not just iron, but all the other nutrients are deficient in their body. So they get dimorphic anemia. All different types of unnatural blood cells are present in their blood sample. That is dimorphic anemia. Is the major types clear? How it looks like under the microscope when you check the blood sample? Okay, based on that, this is the classification we give. So iron deficiency anemia, why does it happen? First reason is you are not having enough iron. Okay, your iron intake is not adequate enough. Inadequate iron intake. So that is giving you iron deficiency anemia. Second is not having, even if you are having good iron intake, your body is not absorbing iron. That is inadequate utilization of iron. Okay, you are having a balanced diet. Okay, proper balanced diet. But as I mentioned in yesterday's class, iron is a very tricky mineral to be absorbed. You eat 100 grams of iron, your body will hardly take up 4 to 5% of it. Okay. You eat 100 microgram of iron, 4 to 5 microgram is what your body is capable of absorbing. Okay. The remaining is lost in feces. Okay. So, first of all, if the iron absorption is tricky, on top of that, your gut does not have a good environment to absorb it. Okay, so that leads to inadequate utilization. You are eating iron-rich food, but your body is not taking it up. Okay. Then blood losses. It could be a road traffic accident, an internal hemorrhage, okay, internal blood loss, heavy menstruation. During childbirth, the mother lost a lot of blood. Okay, any form of blood losses. It could be a surgical blood loss as well. You underwent a surgery and you lost a lot of blood than expected. Okay, so due blood losses, if it is severe blood loss, you have to replace it with blood transfusion. Okay, to save a person, to save a patient who is on the operation table. Okay, they have lost a lot of blood for n number of reasons. How will you save that person? You will have to give them a lot of blood. Blood transfusion has to be done. Okay, so blood transfusion is the last resort of anemia. Okay, last resort of treatment of anemia. Okay. Next is increased requirements. For example, during puberty, during pregnancy, okay, during the growth spurt in both male kids and female kids, both growth spurt. These are the times in your life you have high nutritional demand. Your body has a high nutritional demand. And the food that you get should be able to keep up with that. But if your diet fails you, okay, you are failing your increased requirements. Your body has increased requirements because of your physiological state in certain phases of your life. And the food that you are eating at exactly at that phase of your life is not keeping up with this increased requirements. Okay, that would lead to iron deficiency anemia. Okay. Then inadequate absorption of iron. As I mentioned earlier, if you have some chronic infection, some GI infection, okay, some surgery that was done in your stomach or your intestine, a part of your intestine was removed. Maybe the person suffered from colon cancer, okay, to prevent it from spreading, a part of the intestine was removed, okay. So a part of the intestine that was supposed to absorb iron is also removed. So naturally, the absorption decreases. So those were the causes of iron deficiency anemia. Okay. So diagnosis, how will you diagnose? There is a table, uh, table 13.2, not 11.2, table 13.2 on page 261, those who have the textbook. Different diagnosis and how can it indicate that are you anemic or not is mentioned. So please check that table. You don't have to by heart it, just for your information. Okay. It's usually a person who is from a medical field, they do this reference. Okay, people who work in the hematology department, in a laboratory, in a clinical laboratory, hematology department, pathologist, and doctors. Okay, usually they use this reference to diagnose if a person has anemia or not. What is diagnosis? Diagnosis is with evidence. You have an evidence that suggests that you have this disease condition. So what are those evidences? What all you have to look out for to confirm that this is a case of anemia? So that evidences are given in the table. Okay, that is diagnosis. Okay, so usually the easiest way to find out if a person is anemic or no or not, everyone knows that is your hemoglobin count. Okay, even if anyone has gone for blood donation, okay, you can't just go simply and donate blood. There are certain criteria that you should fulfill. You should be an adult first of all. Minors cannot donate blood. You have to be over the age of 18. Okay, you should not be anemic. If you are a woman, your blood hemoglobin should be more than 12.5. If you are a man, your hemoglobin should be more than 14. Okay, so like that, certain criteria are there. Your blood pressure should be normal. Okay, your weight, your body weight should not be less than 50 kg. Am I audible to all? Your body weight should not be less than 50 kg. Okay, those who are under 50 kg of weight, you cannot donate blood. So these are criteria you should fulfill. In the past 1 year, You should not have had any dog bite, or you should not have had taken any rabies vaccine. In the past 6 months, you should not have done any tattoo or piercing in your body. Okay. In the past 2 3 weeks, you should not have gone through any infections. There are a lot of criteria that one has to fulfill to be eligible to donate blood. Okay. And out of that, every it's always checked what is your hemoglobin count. Okay. So age wise, it is given. Okay. Usually we will just check for adults. In adults, if it is a pregnant woman, am I audible? Is my screen visible? Am I audible? Yeah. So non-pregnant women who are above 15 years of age, 12, at least 12 gram per deciliter should be your hemoglobin count. Pregnant women above 15 years of age, your hemoglobin should be more than 11. Okay. And for men at any age, if you're an adult man, more than 13 should be your hemoglobin count. Okay. If your hemoglobin is below these given numbers, it means you're anemic. Okay. These are the hemoglobin levels that World Health Organization has given as a cutoff to diagnose anemia. Okay. Any woman whose hemoglobin count is less than 11, non-pregnant woman, if it is less than 12, she's anemic. Pregnant woman, if it is less than 11, she's also considered anemic. Then stages of iron deficiency. Always remember, hemoglobin comes down at the very last stage of anemia. Okay. When you see that your hemoglobin levels are dropping, it means you are at stage 3, but anemia has developed way before it. Okay. So in stage 1, your ferritin levels will drop down. In yesterday's class, I have mentioned what is ferritin. Can anyone recall what do you mean by ferritin? Where do you find ferritin? What is the role of ferritin and where do you find ferritin? Yeah, ferritin is found in the liver. It stores iron. Ferritin is the protein that stores iron, that helps to store iron. It's found in liver, and also where else do you find ferritin apart from liver? Yeah, in intestine, in your small intestine, and in your muscles, and also your spleen and your reticuloendothelial system in your bone marrow. Your bone marrow also has ferritin, spleen has ferritin, liver has ferritin, your intestine, small intestine has ferritin. Wherever iron has to be stored for it to be used, ferritin will be present. Okay, in stage 1, ferritin levels will drop if you don't have enough iron. Okay. So when you take supplementary pills like iron tablets and all, again, you have to follow some rules. Do not take it with calcium source. Do not take it with milk. Don't take your iron tablets with milk. Okay, there are rules that you have to follow. Take your iron tablets with orange juice, lemon juice, okay, pineapple juice, amla juice, which are rich in vitamin C, but do not take your iron tablets with milk. Okay, so there are certain rules that you have to follow while taking supplements for iron. Okay, so first stage, ferritin will fall. Second stage, transferrin will fall. So where do you find transferrin? What is the role of transferrin and where do you find transferrin? Yeah, transferrin is found in blood. Okay, it helps transporting transferrin transports iron. It's a protein that transports iron from point A to point B. Okay. In second stage, you are still not improving your diet, or your body is still not absorbing iron. In the second stage, transferrin levels from your blood will drop. So when you do a blood test, if the transferrin levels are lower than normal, means you are in the second stage of anemia. Okay. And finally, you have still not improved your nutrition. You're still not improving your iron intake, or body has some issues with iron absorption. Finally, you will reach the iron deficiency anemia, where your hemoglobin will finally start to reduce. Okay, it will start to decrease. That is stage 3. Okay, so usually you will require supplemental ions in stage 3. Stage 1 and stage 2, just by incorporating more nutritionally rich food, iron rich food, following certain rules of iron absorption, you can enhance the iron absorption. Okay. But when you reach stage 3, you will require help of supplements, iron supplements. All the stages, is it clear to all? So clinical finding, what happens when you reach iron deficiency anemia? What happens to your body? How do you behave? So immunocompetence will come down. People who are anemic will easily fall sick, will easily catch up with infections. Their immunity goes down. Okay. Diminished work performance. Even if you're an adult or you are a child in the school, you will not be able to work properly. Your focus reduces. Okay. You get tired easily. Focus is also a brain's way of burning energy. Okay. So to do a work with full focus, you should be nutritionally, you should be well nourished. Okay, your body should have enough amount of carbohydrates to burn, because the brain burns a lot of calories when you do a focused work. Okay. Then cognitive development in children reduces. Anemic children do not develop well as compared to non-anemic children. Their cognitive development, like the mental calculations that children have, the smartness that the children have, their emotional adaptability, okay, intellectual abilities, these all get affected. Behavioral implications, they're very irritated. They are the problematic kids in the class. They're very irritated. They get spurts of anger, and suddenly they will feel tired. They go into depression. So these are the behavioral changes that we see. Okay. Then structure and function of epithelial tissues, especially in the intestine, okay, it changes. Again, it leads to more complications, okay, especially your mouth, your stomach, your eyes, everything appears paler, okay. And there is a situation called koilonychia, spoon-shaped nails, okay. So at a physical level, just to find out if a person is anemic, even without the diagnosis, if you find spoon-shaped nails, very pale, okay, peach-colored pale eyes, okay, the conjunctiva, the tongue, if these are very pale in color, they don't have that bright pink color, it also implies the person is anemic. So treatment, iron supplements, ferrous sulfate supplements, okay. Along with that, vitamin B12, folic acid supplements, because the presence of vitamin B12, folic acid, vitamin C, it will enhance iron absorption, okay. And the source is, the best source of iron is non-vegetarian food like liver, beef liver, regular liver, organ meats. They are really good sources of iron. Seafood also, dark colored fish. Dark colored fishes are good sources of iron. Like kingfish, we call it as surma in Hindi. I guess in Maharashtra and all, it's called surma. Those fishes are good sources of iron. Non-heme sources, dark green leafy vegetables, dry fruits, nuts, and seeds. Second best sources of iron. Okay. And we have folic acid deficiency. It leads to folic acid deficiency anemia. That is also another form of anemia. Again, it will lead to less amount of hemoglobin. Okay, because your body requires, your bone marrow requires folic acid as well to produce red blood cells. Okay? Why does folic acid go down? You are not having proper diet. Your diet does not have enough number of vitamin B complexes, and also if you come from a region which eats a lot of polished rice, white rice, polished rice, okay, and you use the straining material, a method of rice cooking, especially when you have polished rice, white rice, and you strain away the water and cook the rice, okay, you will be having the deficiency of folic acid. Okay. Then increased age, the absorption reduces. Alcoholism also causes folic acid deficiency. Vitamin B complex deficiency definitely happens with alcoholism. Okay. Then absorption, if it reduces, like if you suffer from celiac disease, if you have a lot of infection in the intestine, okay, a part of your intestine is removed, will lead to deficiency. When the demand is high, but you're not eating enough, like in pregnancy, during infancy, during the weaning period of the infancy, hemolysis, um, there is a lot of blood breakdown, like leukemia, okay, cancer, dermatitis, when you have severe dermatitis, skin infection, okay, itching skin infection. In these situations, demand of folic acid is high, but you don't eat enough, okay, that leads to deficiency. Then if you are on these drugs, okay, these drugs are used in chemotherapy, also oral contraceptive pills. If you're a woman who is taking OCP, oral contraceptive pills to avoid pregnancy, there is a chance of folic acid deficiency anemia. Am I audible? You can check the recording. In the recording, it will be audible, okay? Whatever you have missed. So these are the clinical features. Sensation of weakness, numbness, tingling of fingers, toes. Okay, if you have numbness and tingling of at the tip of your fingers and toes, it is a sign of folic acid deficiency. Frequently, you get a lot of ulcers in your mouth and also ulcers at the corners of your mouth. Okay, angular stomatitis, we call it. Angular stomatitis. Okay, ulcers in the mouth, ulcers in the corners of your mouth. That also leads to folic acid deficiency. Okay, that's a sign of folic acid deficiency. Sore tongues, feeling of weakness. Okay, these are the clinical features of folic acid deficiency. So treatment, daily 5 to 10 mg daily dose you have to take. Okay, blood transfusion in severe cases. Okay, especially if your hemoglobin is less than 5 gram, 5 mg per deciliter. If that is the hemoglobin count, then definitely blood transfusion is your only way of getting treatment for anemia. Okay, include more pulses, legumes, green leafy vegetables. If you're a non-vegetarian, add more organ meats in your diet, fish, eggs. Okay. The hemolytic anemia, it is an autoimmune disorder. Hemolytic, hemo, blood cell. Lytic, breakdown. So your own immunity is breaking down your red blood cells. Your own immunity, your own blood cells are breaking down the red blood cells. Okay. So reason we don't know why it happens. Okay, but also stressful living, especially in women who are chronically stressed, traumatized. Okay, they are at the risk of developing some autoimmune disorders. Okay, it's idiopathic. That is, idiopathic means we don't know yet what is the exact cause. And it can be related to some side effects of medication, okay, and underlying disease process. So prevention, how do you prevent anemia? First is your diet. You have to improve your diet. Okay, understand how which nutrients complements iron absorption. According to that, you have to eat. When we will discuss the part 2 of iron next week, we will get into the details of it. Okay. Supplementation when it is required. Your hemoglobin levels are down than normal based on your age group, based on your gender. If your hemoglobin levels are down, you definitely require supplements. Okay, and it's not that you had supplements, the hemoglobin level came up, you stop supplements. No, it's not like that. Even if your hemoglobin levels are up, you still have to continue the iron supplements for the next 1 month. Okay, because you are allowing your liver to fill up the stores as much as required. Okay. Then education, create awareness when a woman, especially women who are planning to get pregnant and pregnant women, when they visit obstetrician, okay, when they visit their obstetrician, that is the right time to give this education to pregnant women and women who are planning on pregnancy. That is the correct time. They are the target population to give education about iron deficiency anemia, good food, what to do, what not to do when it comes to anemia. Okay, that's the right time. Okay, young mothers, teenage girls in school. Okay, these are the target audiences, target populations. Okay, because mothers and women, they will not only take care of these valid points, these educational points into and inculcate into their life, but with their help, the entire family's nutrition will also be uplifted. Okay, so usually women are the target audiences for health education when it comes to nutrition. Okay, then fortification. Now we have double fortified salt, which comes fortified with iron and iodine. A lot of oil as well. Many oil and flours, atta that you get in the market. Garam masalas, different masalas. Okay, they also get fortified with iron. And also milk that comes in carton. Okay, plant-based milk, almond milk, soy milk, which comes in carton. They are also fortified with iron. So government is including a lot of food fortification policies to enhance the entire population's nutrition. So fortification will help with that. Okay. So that's all for nutritional anemia. If you have any queries, you can mention in the chat box.